Hello, Sam. My name is Moaad Alfarh. I'm your respiratory therapist today. I was sent here by the hospital to design a care plan for you. I do know that you have been recently diagnosed with COPD about 2 years ago, but why don't you tell me more about yourself and the symptoms that have been troubling you? Hey, how's it going? Yeah, my name is Sam Rodriguez. I'm 45. I'm obviously a male. I was diagnosed with COPD about 2 years ago. I started smoking when I was 17, and when I got into the military, just kept continuing and continuing until they kind of recently said I had this COPD thing that's been troubling me for 2 years. So I was not able to re-enlist back in the military, but that's okay. I did my time. I was admitted to the hospital recently, and I came into the ER. I was feeling short of breath, felt a little dizzy, kind of like loopy. I've only gotten that feeling once before, and that was when I had to get that tube down my throat, and they put me on the breathing machine. But I've tried to quit a couple of times cold turkey. It's been kind of difficult, go back and forth and all that. I have made recent improvements. I used to smoke the Marlboro Reds, but now I'm just smoking Marlboro Light. So, hopefully a little light. I think it's like kind of a diet cigarette type thing. I see. Well, how about you tell me a little bit more about yourself, Sam? Such as things, your medication use or anything like that, anything that you have any trouble with before we start planning your COPD management. Well, on top of, cutting down from Marlboro Reds to Marlboro Lights, I have started picking up vaping, and I heard a lot of people are quitting using vaping, so probably gonna stick to that along with a little bit of cigarettes, kind of wean myself off, since, I'm pretty young, I'm 45, so I got time to quit. I see. Well, how about you give me a little bit more detail of your everyday life, such as waking up, how you feel throughout the day, what do you do, kind of a routine of yourself. Well, since the military, I really haven't had a lot of easy nights when it comes to sleep. It's kind of been difficult and all that, but kind of 3, 4, 5 hours a day. Wake up in the middle of the night. In the morning I do wake up and enjoy a cigarette with my coffee. I just kind of have to have that, and then also a cigarette after my breakfast. And then later on throughout the day, I do kind of try to stick to vaping and, lowering my cigarette usage. My other daily activities include, I like to walk my dog, although sometimes throughout the last 2 years it has been difficult for me to kind of find the energy to walk the dog. Also, I find myself going lower and lower when it comes to distance of walking my dog. He doesn't like that, but I get very short of breath throughout these walks, and I gotta take care of myself also. That's very understandable. A lot of times when people are going through COPD, they don't understand their limitations yet. So we kind of have to find out what are your limitations and what we can do for those limitations. You said that you feel short of breath. When you feel short of breath, what do you usually do? Well, when I'm short of breath, a lot of times I like to use that nebulizing thing at home, the one that they gave over here in the ER. I like that, but they gave me this inhaler, and the RT dude said it was the same thing as a nebulizer, but it don't work for me, and honestly, it tastes nasty, and so I don't use it as much as I try with the nebulizer. But the nebulizer at home, it's only for home use, unless they made some different one where I could use for the road. That would be really helpful, because whenever I use a nebulizer, I don't feel really short of breath. A lot of times I'll use a nebulizer before I smoke a cigarette, so I don't feel as short of breath. That's very understandable. Many times when it comes to nebulizers, people do enjoy them a lot better than having to do inhalers. But there are some equipment that is used for the inhalers that can help provide a much more beneficial treatment. Yeah, well, hook it up with one of those, because, it really would help. For all the, that way I try not to come to the hospital, but, it's kind of a hassle with all that. And a lot of times when I stay in the hospital and all that, I do feel like uncomfortable, and probably from nicotine, and, I don't usually like using those patches. They make me feel all weird and all that. So, no, of course, we'll go through all of that. I just want to get more of a basis of yourself and all that, but we'll start attacking everything one by one. So, is there anything else that I should know about your COPD and your COPD management, such as oxygen use? If you do, I have oxygen at home, those boxy things called the concentrator. But, it's kind of hard because it don't go far, and I don't really like the little oxygen tanks because they run out quick. So, it doesn't really help that much. A lot of times when I'm walking around outside, I feel lightheaded, feel short of breath and all that. So I'll go back inside, sit down, use my little oxygen thing, and feel a little bit better a lot of times. Sometimes I might need a nebulizer, but I kind of manage it pretty good. When it comes to COPD and the use of oxygen, it is more of a as-needed type of situation. When you tell me that you go outside and you don't need oxygen, that does sound great, but it's a little concerning the fact that you say you feel lightheaded and you feel short of breath until you go back inside where you use the oxygen and the nebulizer, and you feel a little bit better. There is a device that I want to show you, a device you're most likely familiar with, but it can be used for home, and we'll go back and discuss that when it comes to talking about different devices to use for your COPD management. I do have a couple of questions for you, sir. I do see that you were intubated one time, and that was when you were diagnosed with COPD and your first COPD exacerbation. Was there ever another time where you came to the hospital for COPD? Yeah, I came for that. They put me on that one device, that CPAP. That CPAP thing really did help, and they were saying that I might need a tube, and I was feeling, it was kind of confused to me and all that, and then they put me on that CPAP, and I kind of remember kind of waking up and feeling myself a little bit better and not needing to be, what they call intubated or get the tube or whatever they call it. Oh, that sounds great. Anytime we're able to avoid having to intubate a patient for a COPD exacerbation, we always consider that a win. And the device that you were placed on, although it may seem to have very characteristics of a CPAP, it's called a BiPAP. And with the BiPAP, we use it for blowing off CO2. And with the CPAP, it's used for more sleep apnea. But we can discuss that in a little bit later. I'm just trying to gather all the rest of the information from you. No, I understand, but I just want to know, when are we going to take a little break, or just a little smoke break, because, feeling kind of jittery and all that, but, and it's cool, we can continue. Okay, so moving along. As we talk about all the subjects that we have to go through, our first subject is, of course, quitting. We have to get you to quit smoking cigarettes. Now, there are multiple ways that we can help quit cigarettes. I do understand that you have tried different strategies to quit, but I do feel that you are a little misled by some of the fallacies that are given by vaping, by light cigarettes, such as Marlboro Lights and stuff like that. So I do want to address some of these issues before we get into the therapies that we can use. No, I don't smoke fallacies, I smoke Marlboro Lights now. Fallacies is not a cigarette. What I mean by fallacies is something that is said about a product or item and is not true. For example, there was a big fallacy a long time ago about cigarettes, how it was healthy and how it could help you lose weight. Also, there was fallacies about bread, about how healthy it was and what the body needs. And now we understand that both cigarettes and bread are not as healthy as people may have thought they were. In fact, they're not healthy at all. Okay, I understand now, but keep going, please. I'm very interested in the different strategies that you may have to help me quit. The first strategy I do want to use is non-medication, and that would be something like therapy. I have multiple friends that are in the military, and a lot of their smoking comes from different reasons, whether it's stress, whether it can be PTSD. There's a lot of different things that may factor into their smoking. So I do want to be able to sign you up for, whether, if you do agree to it, whether it be a therapy for military veterans or a therapy for smokers, whatever one you may consider. If you want both, that would actually be very beneficial. Yeah, go ahead and sign me up for the veterans one. If there was a veterans one where veterans that smoke, that'd be even better, but I don't mind, therapy with a bunch of veterans because they understand how things work. Sounds great, Sam. Trust me, therapy is always a good thing to start addressing all your issues or identifying some issues that you may not know about. Another thing that I want to help you quit smoking with is Chantix. Have you ever heard about Chantix? Yeah, Chantix. It's the little thing with the pretzels and the other thing that's like the square, and then the little bread thing comes in a little blue bag, like snacks, right? That's Chex Mix. Something totally different. Chantix is a pill that can help lower the urge of smoking. Oh yeah, you know what? I knew that. I think I seen a commercial about it with it's like an ostrich on there or something like that. I guess the ostrich used to smoke and now he don't smoke no more because of it. Yeah, exactly. The ostrich. It's a weird character that they use for the commercial, but the medication is actually very beneficial. In fact, 1 out of 4 people who use Chantix actually stop smoking, which is a huge benefit. If we can stop 25% of the people that are smoking to stop smoking by just using one type of therapy, it is a huge thing. And basically you have a 25% chance that it will help you in being able to quit smoking. Yeah, I'll try that. But I don't really like the pills a lot, and is there any like side effects to it or anything like that, or make you feel weird, or Yes, unfortunately there are some side effects to Chantix, such as there are side effects to every medication. When these side effects become overwhelming, you must stop and consult your doctor about it. You don't want to hurt yourself trying to help yourself. Some of the side effects that included in Chantix are stomach pain, indigestion, headache, weakness, sleep problems, and I do understand you already have sleep problems to begin with. But the fact that Chantix can help 24 to 27% of smokers quit smoking is more than enough of a reason to be able to at least give it a try. But I do recommend you trying therapy before resulting in Chantix. Anytime that we can address an issue without dealing with medication is always a much more beneficial and more likely to not go back to smoking. I understand. No, that sounds good. I'd rather try therapy first, and then if I have to resort into medications and that. But definitely, I agree with you. Thank you. Another thing that can help quit smoking is nicotine patches. I'm sure you are aware of it, such as most of us in the United States know what they are. Basically, it's a little patch that will go over any part of your skin that will give nicotine to the body, thus the body not wanting to smoke. Yeah, I got a lot of those patches. They don't work. It seems like I use more and more, and those things gives me headaches and all that, so I don't really like the patches. That's fine. Anytime we can find anything to help quit smoking is good enough. The fact that you don't like nicotine patches, but you are willing to go to therapy to see if we can help quit smoking, and if that doesn't work, you're willing to use Chantix, is more than motivation enough to try and get you to stop smoking. Another subject I want to talk about next is symptoms. What type of symptoms you have and how you kind of address them. Like asthma patients who just get short of breath and use a nebulizer and, dizzy or whatever. But I think that's because you don't have oxygen to the brain or something like that. But yeah, just short of breath. Yes, feeling short of breath is the most common symptom of COPD and asthma. But the one thing I did want to address is the fact that you said you feel dizzy and lightheaded, and you think that is because lack of oxygen to the brain. But the one thing I do want you to understand that with COPD, you retain carbon dioxide, and that carbon dioxide is what makes you feel lethargic, loopy, and your CO2 levels are becoming a little bit more higher than they typically would, causing that. The one thing that we need to do to correct that is the use of BiPAP. BiPAP can help blow off that CO2 to get you in a more normal state of mind. Home machine, I don't think I could afford one of those for home. That's way out of my budget. No, I understand. No one can afford a BiPAP for home use. But there is devices that can help blow off CO2, such as a Trilogy. Home Trilogy units are used for BiPAP use for patients that have had multiple exacerbations. Fortunately and unfortunately, you do not qualify for this at this point because you have not had multiple COPD exacerbations and admissions to where your insurance may be able to cover it. But that is a good thing. The fact that you haven't had multiple exacerbations is never thought as a bad thing, only a good thing. Next, I want to talk about the medications. What medications do you use for COPD or other daily? Well, I just use albuterol and that's it. When I get headaches, just Advil or Tylenol, whatever, but that's it. I don't use anything else. Cigarette, yes, that's I know that ain't good, but yeah, that kind of calms me down. But well, one of the new medications that we want to introduce to your COPD management plan is Spiriva. Spiriva is not a medication such as albuterol where you take when you're feeling short of breath. It's a medication that you take once a day, and it helps reduces the chance of bronchospasm and the causes of COPD exacerbation. Yeah, well, I want to make sure I don't take it like that, so I don't want to confuse them or anything like that. Do they look the same? No, that is a very understandable concern, and it is also a big concern of ours. But we are also able to provide you with a chart that has all the pictures of every medication that you might be taking as a COPD patient and what category it lies in. Also, frequencies of these medications will be available for you to view. That way, you can tell the difference between a medication like Spiriva that is used once a day and a medication such as albuterol that is used between 4 to 6 hours a day as needed. Talking about medications such as albuterol inhalers, it leads us to our next topic, which is equipment. One of the first equipment that we must talk about is a chamber. Now, the name chamber might be also associated with different names, such as spacer, the most commonly used name for the device. This device attaches to the albuterol inhaler, in which that you are able to take the treatment, ensuring that medication is delivered to the lungs, not to the back of the throat, with the best deposition into the lungs. Provided you with one of these devices and provided you a link to a video that will show you how to use the device. Also, we have given you a pamphlet, step-by-step directions on how to use the device. The device I want to talk to you about is pulse oximeter. Now, many times you have come to the hospital, they have put a little device on your finger. This is to measure your oxygen level. You can easily purchase a pulse oximeter at Rite Aid or online for about $10 to $15. Sometimes you might see them for $20 to $30, but no need to buy a fancy one, just need to get one for yourself. This will help measure your oxygen level. Your oxygen level should be in between 88 to 91. If it is above without using oxygen, then that is okay. If you find yourself using oxygen and it is above that value, you might be advised to lower the oxygen. Maybe if you're on 3 liters nasal cannula, you can lower it to 2 liters. But ideally, we want you in the oxygen saturation of 88 to 91. What I want to talk about is oxygen tanks and portable oxygen concentrators. You talked about how it is difficult for you to walk around because your oxygen tank runs out, so you constantly have to go back to your oxygen concentrator at home. There are devices that we will try to get you approved for, and one of those devices is a oxygen concentrator in which you can take as a small bag. This will help you ensure that you are not having episodes of low oxygen in your blood to where it might affect you while you're walking around out in the street or anything like that, to where you're not able to use your oxygen home concentrator. Most insurances don't cover this. We will at least ensure that you will get portable oxygen tanks in order to be able to go outside and enjoy the day without having to worry about your oxygen level. We do understand that it can be a hassle to fill these tanks, but it is a needed step to ensure that you get the best quality of care and quality of life. Yeah, it's always hard for me to get those little tanks filled, and when I call, it seems like it takes a while for them to get them filled. It's just kind of a hassle, so sometimes I don't even bother. Unfortunately, sometimes customer service can't be the best, but in order, again, to ensure the best quality of life for yourself, you do need to call them and ensure that your tanks are being filled. Next device I want to talk about is a peak flow meter. A A peak flow meter is a device that can measure by blowing through how your lungs are able to expel air. This can help recognize symptoms, signs of any type of possibly COPD exacerbation. Now, while the values are very difficult to follow, we made it easy for you and we provided you a chart. And with this chart is also instructions on how to use it properly, along with a link to a video to show you how to use proper peak flow use. There are many benefits to using a peak flow meter. The three main benefits of it is to know when to call 911, also when to recognize signs and symptoms of it, also to treat and see how your treatment went. So if you use a peak flow meter, then you use a breathing treatment, and all of a sudden your peak flow is much higher, then it shows that the medication that you just used is probably working. It's kind of difficult. I'm having very trouble following. This is a lot of stuff. And this is why we are not getting very in-depth about everything. We do have pamphlets and other things that we will give you into a packet highlighting everything that you need to know about every situation, every device, and every medication. Looking back at some of your information, it seems to me that you also had pneumonia when you came into the hospital. Now, do you understand pneumonia or have any questions about it? Well, yeah, I know it's like it messes with your lungs, makes you short of breath, and for people with COPD, like they told me I'm more likely to get it and stuff like that. But one thing you also need to know is that there are vaccines to help avoid pneumonia, and it is recommended for COPD patients to take this vaccine. The vaccine is called PPSV23. Now, this vaccine helps, the 23 is because it helps guard against 23 pneumococcal bacteria of the lung. So it can help you from getting COPD exacerbation on top of pneumonia when you have a COPD exacerbation. Dealing with pneumonia and COPD is very difficult and can cause you to be intubated or result in having to be on BiPAP for numerous hours of the day until we are able to correct that pneumonia and adjust your CO2 to the proper range. More importantly, your pH to the proper range. Okay, yeah, I'm down to get a vaccine if it will help not get pneumonia. I'm down for that for sure. It seems like I am done going through any material that I have, but there is a couple more things I need to address. We talked about cigarettes and you smoking light cigarettes. Light cigarettes are not like Diet Coke to Coke. It is totally different. You are still getting the same effect. It is less nicotine, but it is still as bad for someone than regular cigarettes. There has no proven studies to show that Marlboro Light has less chances of having COPD exacerbations or causing COPD than regular Marlboros. Here I thought I was like cutting down. I end up smoking like 3 or 4 of those when I used to smoke like 1 or 2 reds. It feels like it doesn't even cut or anything. It doesn't help me at all. You are getting less nicotine, thus you are resulting in smoking more cigarettes, which is even worse than before. I got you. What about vape? In my mind, that was the next topic I wanted to talk to you about. Vaping has not been associated with quitting cigarettes. If someone happen to purchase a vape and they happen to quit smoking, it is not because of the vape. It is because they chose to quit smoking. Vaping is just another way of your body getting harmful nicotine on top of unknown vape effects to the lungs, in which short-term studies have shown it to be a very bad thing, but the long-term studies have not came out yet. So you are becoming a test dummy for vape. You do not want to be a test dummy for vape. It is difficult enough to deal with COPD and the signs of symptoms of a COPD exacerbation. You don't need other factors of COPD exacerbation on top of normal things such as air quality or anything else that might affect your COPD. Well, a dude at the smoke shop said that a lot of people quit smoking because of it. People may quit smoking because of vaping, but then they result into vaping, in which the effects of vaping could be worse than cigarettes. Well, thanks Thank you, sir. Thanks, Doc. I really appreciate it. Honestly, I feel like tossing these suckers right now. I don't even want to touch them anymore from all the information you gave about it. It is my job, and I am a respiratory therapist, not a doctor.